Let's talk about Achilles tendinopathy, also known as Achilles tendinitis. It's a very, very common thing to have. It normally happens in people of middle age or older, and it's often due to an overload. Sometimes you don't know what's caused the overload, sometimes you do. I see all sorts of different people with this problem. It's essentially an issue where the tendon is not quite healing itself properly. It's not removing old cells. The tendon gets thicker, normally in the mid part of the tendon rather than where it inserts, and that means that it becomes painful. New nerves and blood vessels can grow and they cause ongoing pain. The predominant treatment for this is physiotherapy with eccentric stretching exercises, and I'd thoroughly recommend that anyone that thinks they have Achilles tendinopathy should see a physiotherapist first. There are other things that can be done for this problem though. The first would be shockwave treatment, which is an external device placed on the tendon. It develops significant energy. I think of it like a mini jackhammer. The energy causes minor microscopic damage to the tendon and essentially kickstarts the body's reaction and normal healing processes. That's given between 3 and 6 sessions weekly, and I'm happy to do it at any of my private hospitals for you. So sometimes it is necessary to operate on Achilles tendons because we're not getting the right benefit with the physiotherapy. When we're talking about mid-portion tendinopathy, so essentially where the tendon itself is a problem, it's very uncommon, but it's certainly an operation that all foot and ankle surgeons in the UK will do, including myself. The operation is to clean the tendon out and cause some damage which is more than microscopic to try to kickstart the body's normal reactions into healing. The more common type of tendinopathy that requires surgery is where it's an insertional issue. In other words, where the tendon is plugging into the heel bone. That can get calcified or turn to bone, and when that happens, physiotherapy often isn't very good at treating it and sometimes can make it worse. I'd always recommend trying physiotherapy first, because if it gets better with that, it's going to be a lot easier than having an operation. The operation itself involves usually taking the tendon off the heel, cleaning all the bony abnormality away, thinning the tendon and then replacing it back on the heel with a device called a speed bridge, and there's another video on the website which shows what that means. If you think you've got problems with your Achilles tendon, I'd be very happy to examine you, get the correct imaging and do the correct treatment.